We've acknowledged that we haven't always got it right on how we make decisions, but we did listen to Manitobans, and they said put that money to things that will make a real difference, and they put a priority on infrastructure, and we're building records amounts of infrastructure in this province, so roads, sewer and water, flood protection for peoples. But over and above that, we're also committed to better schools, personal care homes, and daycare, including daycare facilities. So we have to have a plan that will allow people to work and have the supports they need to do that, and that includes a very big commitment to infrastructure. And we will continue to do that and lead the country in a low unemployment rate and job creation. Those are things that make a real difference right now in these fragile economic times.
Yeah, we've listed off a number of examples of waste in the past months, as you know, and rushing a stadium project cost already $30 million. Sole sourcing contracts for these tiger dams, these flood fighting things, is $14 million. Nobody shopped. The NDP didn't bother to shop. That's on Manitoban. Manitobans are the best shoppers in the country, and they deserve a government that shops intelligently with their money and with compassion.
Do just exactly what we're doing. There's reasonable, fact-based, evidence-based fiscal management that has to occur in whoever the next government is, and that's what we've committed to doing. But we also have to be thinking about long-term. What you're hearing a lot of is four-year politics, right? They're talking about 4 years, and what I'm talking about is a vision for the future of where we need to go. That's why I continuously talk about preventative measures. That's why I keep talking about being proactive. We know certain situations are going to occur. We knew 10 years ago that the boomers were going to, our seniors will need our help. And what did this government do about it? Nothing. ER wait times are a symptom of a bigger problem. So the symptom, the problem is mental health, that people are going into hospital rooms with anxiety issues, thinking they're having heart attacks, just basically. You have seniors not being able to go to a home after they come into the hospital, so you have floors of hospitals being filled with seniors who need some help.
It's a horrible situation in Manitoba right now. The average wait times at Grace or Concordia mean that a person could travel to Vancouver and back in less time than the average wait. And you think about the pain and suffering that people are enduring right now in Manitoba while they're forced to just sit at a tremendously vulnerable time in their lives. We've got to put that at the forefront and focus on it.
Yeah, three things. First of all, people always ignore the fact that on ER wait times we have the lowest return rates. When we look after people, they don't come back as frequently. Some other jurisdictions churn them through quickly and then they're back again. First and foremost, keep people healthy so they don't have to be in ERs. This is about healthy living. This is about healthy food. This is about keeping the cost of living affordable so people can afford those healthy food choices. And then very specific things like quick care clinics, which allow people to get care they need without having to go to an ER. And then when people do go to an ER, we may have to make sure there's a place if they need those longer term care solutions of assisted living, affordable living, personal care homes, and we're building those.